November is Lung Cancer Awareness Month.
According to the Centers for Disease Control, more people in the United States die from lung cancer than any other type of cancer. An estimated 150,000 deaths just last year.
And HealthWatch, Shelley Botat shows us how Aurora Baycare Medical Center treats lung cancer patients using a team approach.
Gene Garaleski feels very grateful.
I feel very lucky to be alive.
In July, Gene was having a CT scan for possible heart problems when it showed something unexpected.
They caught the bottom of my lung, and there was a spot. I cried.
So Gene was sent to pulmonary physician Dr. Raul Mendoza Ayala at the multidisciplinary lung cancer clinic at Aurora Baycare Medical Center, where they treat lung cancer with a team approach.
We have a medical oncologist, a radiation oncologist, the surgeon, the radiologist, the lung specialist, and we discuss the case together. And again, we discuss staging, diagnosis, staging, and the best treatment.
Meaning the patient gets to see all the specialists he needs in one visit at the same time and location.
It was easy for me. I didn't have to run around, go to this doctor, that doctor.
The cancer team decided Dr. Mendoza Ayala would perform a minimally invasive bronchoscopy, which uses a flexible scope with a camera that goes through the mouth down the windpipe.
And then go into the target area as demonstrated on the CAT scan. And then from the inside, we take biopsies.
And after a follow-up needle biopsy, Gene was diagnosed with stage 1 lung cancer.
You hear the word cancer, you'll straighten up in your chair.
Because of other health issues, the team decided Gene's best treatment would be to forego surgery and be treated with 5 sessions of radiation using stereotactic body radiation therapy.
It is pinpoint radiation to the tumor that treats it and effectively cures it. It leaves the rest of the lung or surrounding tissue healthy.
No pain during the procedure.
The earlier you catch lung cancer, the better the prognosis. However, lung cancer does not give any symptoms until it is advanced.
And unfortunately, when stage 4 is incurable.
Which is why Dr. Mendoza Ayala says those over 55 who are at risk, smoked, or have a family history should get lung cancer screening.
And doing an annual scan with a very low dose of radiation CAT scan, we can detect early on spots in the lung, and that can potentially save lives.
Right now, Gene's treatment is complete.
We'll have to wait a few months to see how he responds to his treatment.
They're telling me it's going to work, and I believe them.
Dr. Mendoza Ayala says the best way to prevent lung cancer is to don't smoke, or if you do, quit smoking. To learn more, you can call Aurora Baycare or email HealthWatch at aurorabaycare.com. And that's your HealthWatch. I'm Shelley Botat, Local 5 News.